So we've marked the denture for our upper denture stabilization, and we've transferred those marks to the soft tissue, and I've anesthetized his gums. And I'm going to transfer those marks just one more time here, so we can see the marks a little more clearly. And I'll darken up those marks. And this is where we're going to place our MDL Intralock 2.5 millimeter mini implants in those 6 locations. He has already received anesthetic, and we are ready to begin the procedure. Using the Aseptico surgical motor, setting at 2,000 RPM. We're going to make our pilot drill holes. This is a 1.2 millimeter Intralock MDL pilot drill. Using the 1.2 millimeter pilot drill, we're going to puncture through the soft tissue and palpate the ridge until we find the center of the ridge with solid bone. And we go ahead using copious irrigation, make our hole. With the Intralock system, we're going to drill approximately 80 to 90% of the total length of the implant. I'm going to go ahead and make our second hole. I'm going to remove the bone from the roots of the drill each time. Go ahead and make our third hole. Next, we're going to place the drive lock attachment onto the drill.
Okay.
And attach the implant to the drive lock attachment, just like that. I'm going to now set the placement Aseptico to install the implant to approximately 40 to 50 RPMs, in this case 50 RPMs, and the Newton centimeters are set at 56 Newton centimeters for torque. If we reach that torque resistance, the unit will automatically shut off. And at a very slow speed, we're placing our MDL implant into position. Continue to turn that implant until the top of the drill drive lock attachment just touches the soft tissue. And it is in a very solid bone. Ready to use the next implant. And here we are placing our second. You feeling any pain, sir?
Yeah.
Huh?
Yeah.
No? Is that a no?
Yes.
Good. Okay, we've got our second implant in place. You doing all right?
Yeah.
Good. And we'll proceed to the third one. Now I have 3 implants in place on the right side, and they look very good. There's no implant system in the world that's able to accomplish stabilization of a denture in such short time and little discomfort. We're going to proceed to do the same on the opposite side. Drilling our pilot holes. Hold it. And then we're going to place the next implant. And you'll notice I'm holding onto the buccal bone area to make sure that we're angled in the proper direction. If I feel any vibration at all in the buccal, I will stop and reposition it, but this implant's in nice and solid. And one more implant to place. We've got 6 implants in place. I'm going to take the back of a mirror handle just to check the stability, and they all look perfect. I'm going to turn these couple in just a little bit further with the ratchet driver. You okay?
Hello.
Okay. We're all done. The implants are all in position. We've hollowed out the denture in the 6 areas where the implants marks were, and we've got our 6 housings on the implants. These are O-ring housings that snap on. We've tried the denture in, and now we're going to use our implant attachment resin and reline material, and we're going to fill these holes. A little bit can extend beyond. We're going to go ahead and place that in the patient's mouth. Any excess material that oozes out, just take out and bite together and hold it together. We're going to have the patient hold his teeth together for about 3 minutes, 3 to 4 minutes, and then we'll take it out. It's been approximately 4 minutes now, and we're going to go ahead and snap the denture out, and it came out nicely with the 6 housings in place. All that we need to do now is trim this and polish it. We should be in good shape. Reline the denture, we've polished it, we've placed the 6 housings, and we are all done with the procedure, and the denture snaps right in. It's nice and secure. Bite together. All set to go.